This begins the seminar by Ms. Yoko Okamoto of Rinku Nagayama Hospital titled Demonstration MDRPI Prevention and Management Measures for All WOC Nurses. Explanation of key points by medical devices. We'll hand the floor over to Dr. Okamoto. Hi. As mentioned earlier, my name is Yoko Okamoto of Rinku Nagayama Hospital. Thank you for being here today. What are MDRPIs, medical device-related pressure injuries? How to prevent and handle MDRPIs? Causes of MDRPIs and basic care, flow of care and specific measures. Here, I will be providing you with a summary of MDRPI measures. First, what are MDRPIs, medical device-related pressure injuries? MDRPIs, in brief, are injuries caused by pressure from medical-related devices worn on the body. Medical-related devices refer not only to medical devices, but also to various devices related to the provision of medical care. In recent years, the Japanese Society of Pressure Ulcers has taken measures against medical device-related pressure injuries. For instance, issuing this publication on MDRPI best practices in 2016 and creating a poster to raise awareness of MDRPIs. While awareness of medical device-related pressure injuries, or MDRPIs, is growing in acute care settings, it seems that there are still many in chronic care and long-term care settings who have never heard of the term. That is why during this session, I will be explaining MDRPIs in a manner that is easy to understand and practical, even for those who have never heard of the term until now. First, let me explain the definition of medical device-related pressure injuries. These are injuries to the skin or subcutaneous tissue caused by pressure from medical-related devices. While they are technically distinct from typical pressure ulcers or self-load-related pressure ulcers, these are both pressure injuries and belong broadly to the category of pressure ulcers. They do not include injuries occurring in the mucous membranes of the urethra, gastrointestinal tract, organs, etc. This text states that medical device-related pressure injuries are distinct from pressure ulcers in that they are not caused by the patient's own body weight, but they are included in the same category in a broader sense. From here on, I will refer to medical device-related pressure injuries as MDRPIs. In today's session, I will be going into more detail in regards to compression stockings, NIV masks, oxygen mask straps, intravascular catheters, and more. Next is causes of MDRPIs and basic care. MDRPIs occur due to a complex interplay of various factors. This includes incompatibility between the patient and the size or shape of the device, lack of information about the device, improper fitting, external force, nutritional deficiencies, moisture, thinning of the skin, poor circulation, edema, and reduced sensation, perception, or cognition. There are also the protruding of things like cartilage, bone, and joints, or moisture where the device is worn. These can be separated into individual factors and device factors. Individual factors are the factors that cause MDRPIs on the patient's side. This includes, for instance, thin skin or poor circulation, or more obviously, things like edema or nutritional deficiencies. These factors will require you to maintain close attention to the patient's skin condition and provide the appropriate care. What is important here is first, knowing the patient's level of risk, and second, engaging in regular care. This refers not only to daily care, but also to long-term monthly care. Next are device factors. Incompatibility between the patient and the size or shape of the device can easily cause MDRPIs. Staff must also engage in sufficient communication regarding the device, from precautions to how the device should be fitted on individual patients, and care for preventing MDRPIs. What is important here is making sure to consider the size and shape of the device and engaging in proper fitting. Even with thorough preventative care for individual factors and device factors, it is not uncommon for MDRPIs to occur. In such cases, you should consider the use of various goods to reduce external force and provide care so as to reduce the stress on the patient as much as possible. Next is flow of care and specific measures. First, think about the flow of care in 3 phases: before wearing, when putting on, and after wearing. Understand the risks associated with the patient factors before wearing. Is the skin thin? Is there poor circulation? Is there edema? How is their nutritional status? Next, check the device factors. Is the size of the device suitable for the patient? Is the shape suitable for the patient? If the size or shape of the device cannot be made suitable for the patient, share this information amongst the staff to enable early detection of abnormalities. Even if the size or shape of the device is suitable, MDRPIs can still occur if the device is worn improperly. Is the device being worn properly? It can be useful to create a checklist of these kinds of items. Identifying the factors that can cause MDRPIs will make apparent any potential problems. Now, set up a plan for the kind of care to implement to prevent and handle MDRPIs. The important thing is thinking carefully about what you can do. Work to improve the individual and device factors that have ticks next to them. This includes care to protect the skin, improving nutritional status, patient education, and sharing information amongst nurses. Then, create an observation and care plan for after the device is worn. With regards to care, I recommend you set up a plan with specific times, to the extent feasible. For instance, observation at 10 a.m., 4 p.m., and 8 p.m., and changes at 9 a.m. and 8 p.m. What is important when putting on a device is proper fitting. This will also be shown in the demonstration later. After the device is worn, regularly observe the condition of the patient's skin and implement measures immediately if you discover any reddening. For the regular observations, I recommend 2 to 3 times a day. If you can set a detailed plan, it may be better to set specific times for morning, afternoon, and evening, such as 10 a.m., 4 p.m., and 8 p.m., so as to have the times more evenly spaced out. In the case of reddening or damage to the skin, it can also be good to consider whether the time the patient spends wearing the device can be reduced or if parts of the device can be removed, if even for a short time. For instance, consulting a physician may result in the physician cutting off portions of the cast for a fracture. Now, for a summary of the MDRPI measures discussed today. It is important to care for both individual factors and device factors to prevent MDRPIs. Think about the flow of care in 3 phases: before wearing, when putting on, and after wearing. Proper fitting is what is important when putting on a device, while observation is important after it is worn. Conduct regular observations and work to reduce external force through things like refitting and cushioning material if you notice any problems. If the problem persists, consider whether use of the device can be discontinued, if even temporarily. This concludes my explanations. I hope this seminar was useful to all of you. Thank you for listening. Now, let me explain my tips for fitting and observation for various medical devices, along with video demonstrations, which have become red here. Pull it wide. Make sure the center of the belt is at the center of the back of the head. You can also apply the cushioning material to the straps.